Combining procedures, powerful or risky? Combining procedures can be really transformative, but also can increase the risk. And the difference is not really luck, it's judgment. So many patients ask us, if I am already having surgery, why I just don't do everything at once? It's a good question, but the answer is more than that. I am Dr. Carolina Restrepo, board-certified plastic surgeon and co-founder of Premium Care Plastic Surgery in Cartagena, Colombia. And in this episode, I want to explain when combining procedures is powerful and when it becomes unsafe. There are really good advantages of why combining procedure is attractive. It's only one anesthesia, one recovery period, one time away from work or family, and especially for patients that are coming to Cartagena for surgery, it's only one travel, one recovery, and one return at home. So it's important to have a good selection of the patients because combining procedures can produce great results. For example, if you combine facelift with eyelid surgery, or during a mommy makeover that you combine breast and abdomen, or in body contouring and after weight loss, you can combine breast and arms. When it's planned correctly, these combinations are great and make sense. So risk increases when surgical time increases, when blood loss is a lot, when patient's health is not good or is marginal, or when many areas are really in one session in an aggressive way. Surgery is a physiological stress, anesthesia also it is, and we have to understand that the body has limits. So the key question is not, can we do this? The key question is, should we do this? So here is what more patients don't realize. The safest surgery is not the smallest surgery. It's the surgery that is properly planned, staged, timed, executed, and for every patient there is a plan that is specific. So when we see combination of surgery, we focus in three factors. First and most important, patient's health. So we evaluate the cardiac risk, pulmonary function, the body mass index, the history of clotting disorders, and if one of those are not good or favorable, then it's not wise to combine surgeries. The second one is operative time. There is really no universal magic number for how long, but more than the duration, we have to understand how long the patients are under anesthesia, and we want that to be less than 6 hours. So really, if you are responsible in your surgery, you know the limits, you respect them. And third, tissue trauma. Operating in multiple areas that are close to each other can increase the tension, can increase the risk of wound healing problems. So it's important to evaluate the areas and be strategic about what surgical procedures you are going to perform. What happens in high volume centers like ours, we develop systems that reduce any chances. We have anesthesia protocols, operating flow, we work as a team every day, we have a really strict post-operative protocol. So these systems don't eliminate risk, but they reduce unnecessary risk. Combining procedures safely requires discipline. So some patients believe that doing less means safer, but a staged surgery also carry more anesthesia if you have to do 2 surgeries, more recovery periods, and also more trauma and more inflammation. It's important to understand that in healthy patients, a well-planned combined procedure can be really more efficient and also safe. The decision has to be done patient by patient, especially for patients traveling to other countries. Like when they come to us, this decision is even more critical because we have a specific recovery time of the patient's time here with us in Cartagena The follow-up must be really structured. The travel times have to be taken into consideration when we're doing the surgical planning. So it's not about like doing a lot of procedures or maximizing procedures. It's about maximizing safety and outcomes, knowing that the body has limits. Our approach is conservative but comprehensive. If combining procedures produce a better result without exceeding safety limits, we are for it, we support it. If staging procedures produces a safer outcome, we recommend that we divide the procedures and do 2 or 3 stages. The goal is not to do more. The goal is to do what is really appropriate for every patient and also what patients feel right. So brain surgery requires moderation as much as skill. So when you hear about mommy makeovers or extensive combination of surgeries, don't ask what is possible. You should ask what is responsible for your body, for your healing, for your recovery. Because powerful surgery is not reckless surgery. It's structured and it's patient specific. In the next episode, we will explore something that often gets overlooked in modern surgical marketing, the lost art of caring, and why it may matter more than technique. I will see you there. Please subscribe for the next episode.